Well, good to have you with us here on the Sunday edition of the South African Morning. Let's turn our attention back to the two more COVID-19 variants that have been detected in the country. We understand at least 4 people have tested positive for these variants that have been dominating in India. 2 of those cases detected here in Gauteng and 2 in KwaZulu-Natal. Let's speak to the experts on this. NICD, the National Institute for Communicable Diseases. It's Professor Anne von Gottberg speaking to us now. Professor, good morning to you. Thank you very much for your time in speaking to us so early on a Sunday morning. I mean, how concerned should we be about these variants, understanding that viruses do have variants naturally? How concerned should we be about these?
I think we should be concerned as we are about COVID generally. I think it was expected that we were going to see variants, and that the variants that are being transmitted and are causing disease elsewhere in the world, that they're going to come to South Africa at some time. I think that was expected. So my feeling is we should be looking at disease in South Africa and seeing what generally is happening with COVID-19 in South Africa. We're monitoring this very carefully. There is a good surveillance system in place. But to understand that what we're seeing and what we're sequencing is very much still an underestimate. And so I think it's very important for us to remember that the few variants and detecting them and when they emerge may only be what we're able to detect. I think much more important is for us to look at the general disease pattern in South Africa and for us to respond to cases and increases in cases in each of the provinces and districts.
I don't imagine it would be difficult to understand the very serious concern, Professor, about this variant from India. I mean, if we just take a look at the numbers that have come out of that country yesterday, I'm seeing here that India reporting 400,000 cases in a single day for the 3rd consecutive day. So I imagine of all the variants that we've been dealing with since the start, this, as far as numbers are concerned, it seems to be relatively scary.
Yes, and I think the first thing is to look, India is a big country with a big population, so whenever you're going to talk about just numbers, you're going to be overwhelmed by the numbers that are happening there, and we need to think of rather looking at it by population and incidence and risks when we're trying to compare it to South Africa. But I agree that it is concerning, and it's not quite clear whether this is because of the variant, and if this variant is more transmissible, or whether prior immunity to other variants don't confer immunity to this variant. And these are the questions that we are taking seriously and trying very hard together with the international community, are also going to see these variants to work and research and investigate what might be the explanations. It's also possible that in India, as in other countries, it's not only the pathogen that is important, but control measures, people who are gathering, what happened in that country, what else is increasing transmission within the population.
Prof, before I say goodbye to you for this morning, we're busy taking a look. I don't know if you can see it, but we are looking at visuals of the vaccinations being administered to frontline workers, etc. Of these new variants, these 2 new variants that we're reporting at the moment, do we have any idea yet if our current vaccines that have been flown into this country and being given to healthcare workers, are they effective at all? How do you even begin to measure that?
So 117, the one variant, is quite well known and established, and I think it's a bit more widespread in South Africa already, because we've counted 11, and I think that reflects the tip of the iceberg. I think there's more, and that's the variant that was initially identified in the UK and is already quite widespread in other countries. And for that variant, we have more information and more data, and I think it's established that the vaccines should work for that variant. For the variant that was described first in India, there's still outstanding data, and we haven't done quite as much. But if you look at the mutations and if we look at the details of those variants, at the moment we're predicting that the vaccine should still work. And that is one thing that will be investigated, will be researched very carefully in the laboratories and then in communities where vaccines have been given and where these variants are being transmitted. But for the first variant, I don't think that's so new. I think, and in South Africa, it's been described that we have that variant. I think it's more that the variant from that is established in India, that's new for South Africa at the moment, and that's also the one where there's little less data available.
Professor, perhaps I can squeeze one more question. I'm seeing a question being asked on Twitter asking about the vaccines. If we get to a point with these different variants of the virus, and it is later found that the current vaccinations that we are all going to get here in South Africa aren't effective, how big a change is that to a vaccination? And what happens to all the people who up to that point would have received the jab? Do we just essentially go back to ground zero? Do we reset and just redo the entire population again? Is it as dramatic as that?
Not quite as dramatic, and I think many vaccine manufacturers and policymakers are thinking about this. So what is happening, the vaccines are being updated, and some of those vaccines would be potentially given as boosters, which I think we might have to do in any case, depending on what happens in the next 2 to 3 years. So I think booster doses, so doses that then enhance the first response to the first dose that you've received, are a consideration. Changing the vaccines and making them be effective for the variants that are currently circulating is already happening. And I think people need to understand that the immunity that they've got from the first dose is not lost. That immunity is a start. And the way we become immune to some of these viruses is the boosting of ongoing infections over time give us the best immunity to prevent disease going forward.
And Professor, I promise this really is the last question I'm going to annoy you with on Mother's Day. I just want to ask about the third wave. We are seeing these numbers going up. Is the third wave inevitable in South Africa? Are we there already?
The one thing I've learned with this pandemic and the epidemic in the country is never to be absolutely sure about anything. I think what we definitely are seeing are increases in cases in districts and provinces that are very worrying and need to be addressed immediately and with great action on the public health from the public health sector. How it really pans out and whether it becomes a big third wave or if we just see increases in cases and then it comes down again and we see a fourth wave, exactly how it's going to pan out going forward into the future, I think I'm not even going to predict.
And I appreciate your time on this Mother's Day Sunday as well. Professor, always a pleasure speaking to experts such as yourself, making sense of it for people like me. Professor Anne von Gottberg, National Institute for Communicable Diseases.